professionals work really hard to make sure that your treatment and care are as safe as possible, and the ultimate responsibility for this lies entirely with them. Hospitals, however, are complex systems and things can still sometimes go wrong. That's why we're always looking to improve the things we already do. Recently, we asked some patients, their relatives and some healthcare staff from the ward what kind of things you and your family can do to help the doctors and nurses in hospital to keep you safe. Here are a few of the things they suggested that you can do to help.
Always keep a list of all the medicines you take at home. To keep you safe in hospital, we need to have an accurate and complete record of any tablets and other medicines that you take at home. Write down as much information as you can on your list so that we know what medications you take, why you take them, how much you take, and when you take them. Remember to include any allergies that you might have and medicines that you buy yourself, like vitamins, cough syrups, and herbal remedies. If you don't already have a list, use the one provided in your ThinkSAFE logbook to get you started. Take your list of medicines with you when you go to hospital. Show your list to the member of staff admitting you and tell them about your medications, so that they can confirm that your list matches their records.
You have to write them down like this when you take so many different medicines, isn't it?
Knowing what medicines you take helps us to make sure that you continue to receive all your home medications during your stay in hospital.
Are you currently on any medication, Mike?
I am, yes, I have it on my ThinkSAFE app.
That's great.
Find out about and follow hygiene recommendations for your ward. It is also important that your family and your visitors are aware of these recommendations too. Encourage them to think safe to help protect you from any possible infection. Do this by reminding them to clean their hands each time they come on the ward to see you, and then again when they leave. Remind them not to sit on your bed too. These are important ways that you, your family and your visitors can help minimise your risk of infection. You can remind us to clean our hands too. If you think we may not have cleaned our hands, then think safe and tell us.
Oh,
Right.
could I just ask you to clean your hands first?
Oh, of course, of course.
Sorry, I know you've probably done it already, but I just feel safer knowing that.
No problem at all. Better to be safe than sorry. Anyway, it's good that patients feel comfortable reminding us. Right.
Protecting you from risk of infection is very important to us. It really is okay to remind us. We won't be offended or upset with you. Your safety is our priority. If you are concerned or uncertain about what is happening to you, ask us about your care and treatment. Your questions are important to us and we're here to listen.
Can I just ask you about what you said to me earlier?
Yes, of course. What would you like to ask me about?
Well, it's just, you know, you said that I couldn't get the cast on my leg today. It's just the doctor told me this morning that I could get the cast on my leg today, and now I don't know what's happening. I'm a bit confused. Could you tell me why I can't get the cast on my leg today?
Right, I see.
Sharing information by talking and listening to each other is an important part of making your care better and safer. Ask us about any new, unfamiliar or unexpected medications that you were given to take. Tell us if you think you have been given the wrong tablets, for example.
I'm sorry, these don't look like the pills I normally get. Can you tell me what they're for, please?
Yes, of course. We'd better check that for you. Thanks for pointing that out. Be back in a second with your notes. Okay, let's take a look at this.
It only
here.
takes a minute to check your chart. Before your operation, confirm the correct surgical site with your surgeon. When you are having surgery, the surgeon will mark an arrow on the part of your body that is about to be operated on.
So it's a left knee replacement for you, dear Mr. Brown, is that correct?
That's right, this is the knee you need to mark, definitely.
If this doesn't happen to you, ask us to confirm this with you before your operation.
My pleasure.
Sometimes it can be difficult for us to spot important changes in a patient's condition, so tell us if you begin to feel unwell or not quite yourself.
Did you not tell one of the nurses how you feel? What about the doctor? Did you not mention it to him when he came around this morning?
No. I just didn't want to trouble him.
Should I go and get one of the nurses for you?
Patients often do not want to bother busy staff, but alerting us to changes in how well you feel will help us to keep you safe. Relatives can be especially good at noticing unusual and important change in patients. You and your family have a unique expertise. You know the patient better than anyone. So if you start to feel unwell, ThinkSAFE and tell us about it.
He's a lot more sleepy than he was yesterday. In fact, yesterday he was a lot brighter. I'm just a bit concerned, really.
Before you leave hospital, prepare yourself for discharge. This will help us to keep you safe in your own home.
Well, yes, actually. I was wondering what happens when I get home.
Well, a district nurse will contact you once you get home.
Ask about what to expect following discharge.
Who do I contact when I get home if I have any questions or problems?
There's a list of all the relevant contacts right here in this logbook.
Who you should contact if you have any concerns or need advice. Ask us to explain any new or unfamiliar medications that you were given to take home with you. Use the discharge checklist in your ThinkSAFE logbook for ideas about other questions you might ask. These are some really helpful ways that patients, their relatives and healthcare staff can work together to help us to keep patients safe whilst in hospital. However, we know that it is not always easy for patients and relatives to ask questions.
I've had some feedback over the last week, and what I'm finding is that patients often think we're too busy to answer questions, or that the questions they do have just aren't important enough to bother us about.
I can understand why patients think that. Hospital is often a very busy place, but it isn't troubling us. We are here to listen.
Oh, of course. But what I think is that patients are worried that the doctors and the nurses will think they're criticising them or complaining if they do ask a question, even think it rude or cheeky.
No, none of us would ever be offended or upset by a question.
But it is hard being the patient, though. I mean, they can feel vulnerable or intimidated. But in truth, it's not criticising, it's helping.
Yeah, definitely.
And I think patients just sometimes want to know more about their care and what's happening to them.
That's right. And I think it's important that patients and the families feel that they can speak to us and tell us things that we may not know.
Yeah, they know the patient better than anyone. Patients and relatives are experts too.
Yeah, patients and relatives are experts, so we should all work together as experts to help keep our patients safe in hospital.
Be a partner in your care. Patients, relatives and healthcare staff working together as experts to help improve the safety of patients in hospital. Think safe, be safe.